Hi, good evening, and today at this point of time, I'm very happy and I'm pleased to have these 5 senior clinicians who were with me for the last 3 days for our hair restoration workshop, and it was an amazing experience for me as well to learn from all the senior people so many things which I really picked up. First of all, thank you guys for joining us here for this workshop. It was really amazing and I had a fantastic 3 days time, and I hope we could deliver whatever we had promised, and let us try and understand from you guys, since it's live and it's going to be totally unedited. So let us try and understand, let my followers understand what exactly we have been able to deliver the last 3 days for our hair restoration workshop. Since you guys have come all the way from different parts of the country, so let us try and understand a little bit about our workshop and a little bit about our clinic and little what are you going to take back home from us. So what we will do is maybe we can start from Dr. Nessa. She has come from Delhi, and I understand she was in Dubai last month for another training after the training which she had there. I'm very happy to see you again back with us, and it's a very good thing to keep on going to different places to learn. Right. Actually, what you're doing is absolutely right, and this is the time we should definitely invest in learning. Right. That's one thing which I really learned from you. Every 2-3 months you keep on traveling somewhere to learn. That's in fact very good. I would say 100%. I would give you this thing that you keep on traveling so much to learn, because learning never stops. You should never stop learning, otherwise you're going to be dead. Right. So thank you for coming back to us once again. What do you have to tell your followers?
This is Dr. Maimun Nisha from Delhi. I'm running my clinic, Heavy Skin Hair and Laser Clinic at Delhi. I have 2 centers over there. But sir is my mentor. And again, the lady is behind the camera. She is a YouTuber. I learned really from my heart. I learned so many things. I visited so many places, but I think उतना कुछ नहीं हुआ जो आज I learned so many things. The basic small things. HT में मैं इसीलिए आई. I am doing HT in my clinic, but like advanced techniques, lots of new medicines like FUE technology, and I think मुझे ये क्लिनिक से सर मैम से ऐसा
लगाव हो गया
है और इतनी अटैचमेंट है कि मैं शायद लाइफ टाइम यहाँ आती रहूँ. इट्स माय प्लेस ओनली. तो ये क्लिनिक इतना ब्यूटीफुल है. एक बार विजिट करो, सर से कुछ लर्न करो, तब पता चलेगा. थैंक यू सो मच. बहुत कुछ मैं लेके जा रही हूँ, और मैं ये ऑफ कोर्स ये बात है मैं अपने क्लिनिक में ये करूँगी. और सर तो Sir, ma'am, thank you so much.
Achha, why not we just, since you mentioned the lady sitting on the other side of the camera, why not we call the lady who is sitting on the other side of the camera this side? The lady should not, the commander should not go that side.
No, hi all, and it's always a pleasure. And I would say that, it's always a learning curve. I always say that whenever the batch comes, I think more than giving, it's the learning for us also. We also take so many things from you guys, and that's how we all should grow.
Right. I just wanted to tell one thing. Like last time जब मैं आई थी, मुझे मैं सब कुछ ट्रीटमेंट करती हूँ, बट मुझे एक था फोबिया इतना थ्रेड का कि मैं स्टक होती थी कहीं ना कहीं. और लाइक एक झटके में जो बोला जाता है, मैम ने मेरा हैंड पुश किया और वो सिखाया, और मैं बिंदास अब ट्रीटमेंट कर रही हूँ. आई एम रियली आई डोंट नो क्या अटैचमेंट है, किस जन्म का अटैचमेंट है, but I am really very happy.
Thank you so much. And this is what we expect from you guys to do lots. And मेरा एक वो है कि हमारे जो सीख के जाते हैं, हमारे जो स्टूडेंट्स होते हैं, दे शुड डू मच बेटर देन अस. और मेरे को ऐसा पता नहीं क्यों ऐसा दिख रहा है, अगले 5 साल के अंदर डॉक्टर नेसा के करीबन 50 सेंटर्स तो होंगे. aggressively you are doing. आप भुवनेश्वर में अपना सेंटर चालू कर रहे हो, and then you are planning next. अगर हमारे को कभी नौकरी लगी तो anyway, thank you so much. Thank you for being with us. Okay, now let's try and go to Dr. Vidyulata. She is from Mumbai itself. She has her own aesthetic practice here. And let us try and understand what she has to say about the workshop and how was it overall 3 days. खाने का जरूर बोलना.
Hello everyone, myself Dr. Vidyulata. Yes, खाना 3 दिन हमने फूड बहुत एंजॉय किया. ये अगर आप कुछ अच्छा खाते हो तो आप अच्छा सीखते हो. तो yes, definitely coming on the HT part. हेयर ट्रांसप्लांट मुझे बहुत ट्रिकी लग रहा था. जब मैं यहाँ पे आई थी तो मैं अपने इमेजिनेशंस और यूट्यूब वीडियोस सब देख के हुए यहाँ पे आई थी. बट जैसे ही यहाँ पे आई सर ने सारा उसका हवा निकाल दिया और इतने सिंपल वे में सिखा दिया कि ओके डेफिनेटली एवरीवन कैन डू विद अ वेरी एफिशिएंट हैंड. एंड प्लस वन मोर पॉइंट मुझे बहुत अच्छा लगा कि रियल पेशेंट पे प्रैक्टिस, दैट इज वेरी मच इम्पोर्टेंट. आपको क्या डिफिकल्टीज आते हैं, यू हैव टू हैंडल द डिफिकल्टीज, दैट इज मोर इम्पोर्टेंट. तो ये बहुत अच्छे से सीख लिया. एंड द स्टाफ, सर, मैम, एवरीवन इज very good. Environment of clinic is very good. So I'm really very happy and fortunate. मैं यहाँ पे आई और यहाँ से सीख के जा रही हूँ.
Thank you so much, Dr. Vidyulata. Thank you for being with us. Thank you so much. Now let's go back to Dr. Amit and let's understand what he has to say all the way from Delhi. इतनी दूर से आए. I hope you're taking back something with you.
First of all, I'm very thankful to Dr. Sir and Ma'am. And Sir and Ma'am are very friendly. I tell you again, it is very friendly. He is very and she is very friendly. And she told us about the hair transplantation in a very simple way. He told us about the experience, his experience regarding the hair transplantation. All the 3 days we are doing lot of patient on the non-surgical means as well as on the surgical means. We are doing that. And food was very good, sir. Very nice. I came Bangalore and the Mumbai on the second time, but here the experience was very nice, very nice. All the lectures are flawless, and sir was spandulous. He is a very spandulous person. And I come again, sir. Want to learn something else, and I call sir again in my place also, native place also. Yes, definitely.
See, for me. A group of my fraternity, my maxillofacial people, if I can create something and if I can teach something and if my juniors can pick up and take this ahead, it's a big thing for me.
In the end, I can say I can add up one feather in my cap, and that is hair transplantation.
अरे बिल्कुल.
And
अभी आप ट्रॉमा करते हो, कैंसर करते हो, अरे हेयर ट्रांसप्लांट तो it is.
I want to do more and more hair transplant cases in Delhi.
Should do.
So give me your blessings, sir and ma'am. So we can do it.
Delhi guys,
Delhi guys, look forward to them.
new surgeon on the mountain.
Which part of Delhi you are from?
Shadra.
So
So you
Delhi
guys
is
are
covered.
Delhi is covered now. So जिसको भी चाहिए hair transplant, they can contact you guys.
Definitely, sir. Definitely. We can do it.
Great. Okay, thank you so much for coming in here. Let us try and ask Dr. Neerav how his experience has been.
Yeah, hello all. This is not a hair restoration program. This is an entire trichology program. You learn everything, right from medical therapy, PRP, lasers, LLT, and of course the hair restoration. It's excellent, sir. Any trichology patient that comes across now, we can handle it very well. Surgical, non-surgical, everything. And I love the patient-centric approach, basically. And you guys are so much, ready to answer. You answer more than what we have asked for. You inform more than we would like to know. And excellent, sir. Excellent. This covers all.
I thank you so much. There is really a great compliment which you gave us. That is, from the bottom of my heart, I'm really thankful to you. With a surgical background, I'm sure this is not going to be a very difficult job for all of us. What do you have to say?
It can anybody who has a surgical background can very well learn this, and with a sufficient practice, any surgeon can master this. There is no
Shouldn't be a problem.
Shouldn't be a
problem.
No.
Thank you so much for coming in here. And you have an oculoplastic practice of almost like 4 years now? Or?
No, yeah. In ophthalmic practice, more than 12 years now.
12 years.
Yeah.
12 years now. So it's a big practice. Now you're going to be adding facial plastic into
Right.
it. So that's a
Right.
great approach. because the whole world is actually going into facial plastic and facial aesthetics. So I think it's a great field to be in. Yes, definitely the world is going towards it. So we'll have to move towards that patient-centric approach. Yeah. So finally, let us try and ask Dr. Samit. So he's from Dehradun. Let's ask Dr. Samit how his 3 days has been.
Hello everyone, I am Dr. Samit Jain, maxillofacial surgeon, and I'm in practice since 10-11 years. And since beginning we are doing traumas and everything, but it was my dream to learn hair transplantation. And I know sir, not now, since 2-3 years back, I know sir very well. And I was thinking that I will start hair transplant, and I'll go to him because he's not normal hair transplant, he's a perfectionist. He do everything in a perfect way. And starting from the first day, we just came to know the anatomy and everything. Then we start with the non-surgical therapy, as Dr. Neerav told us and Dr. Nisha told us. And then second day we did hair transplant on patient with hands-on in a very simple way. The environment is so friendly. It's just like a home, as Dr. Nisha told. And when you start doing patients, there's no any pressure on your head that you have to do it in a perfect way, this will happen. You are doing it in a simple way and you start learning. And the third and last day when you come, you are able to understand you can do hair transplant on your own, and that is the best way. When you're going and you have your mind that you can do hair transplant by your way, that is the purpose of this course. So I'll suggest, until unless, first of all, there's no age for learning. So if you are in your practice and you are doing since long practice, yeah, I'm senior, so there's no age for learning. You can come and you can learn from sir and ma'am, both are awesome guys. And second, this is a very 3 days course, and you will definitely start doing hair transplant after the 3 days. That is, I'm sure. I'm taking this message from on the third day, sir. Thank you so much, sir.
That's the biggest compliment which I would actually achieve, that somebody has to say that from tomorrow I can do it. That is what we are actually looking at. I mean, if you have, that is what we aspire to do. If you have that kind of a confidence that yes, I can do it from the day forward, that's all we require. Yeah, we might do mistakes. I mean, we still today we do mistakes after so many cases. That's okay. That's bound to happen. But if you have that kind of
that's the only way to learn
that's
and
the only
grow.
way to learn. And yeah, you're right in saying that. You guys are so good. I really don't know how to express that.
It's all
We-
you are
But
blessed.
you are-
That's why
but you
we
and
are
I are
doing
so
that.
real mentor for us, sir. Real mentor.
Thank you so much, guys.
And
Thanks.
guys, one more thing. On the last day, you will get this eye loops.
We never expected you to we'll go with a return gift.
So at least for the next 5 or 6 cases,
Yeah,
you sorted.
yeah,
That's what
yeah,
happened.
One great
This is a very beautiful gesture. Very beautiful gesture.
So
You
you
should
should.
ask sir and ma'am.
Thank you so much. Thank you so much. Thank you for coming in. Thank you all for coming in and spending so much time with us. Thank you guys for following us, and thank you guys for being with us every time.
Thank you so
And
much.
tag
sir.
more and
Thank
more.
you so much.
Thank you so much, guys. Thanks.